Hi, Mrs. Payne, it's Stacy. How are you doing? I know you can't speak because you have that trach, so I'll try to ask all yes, no questions. So thumbs up for yes, thumbs down for no. Okay, great. So I'm just gonna verify your name and date of birth. So you are still Jane Payne. Thumbs up, great. Your date of birth is 1/1/1960. Thumbs up, great. And an allergy to penicillin. Thumbs up, awesome. So I was checking my orders and it looks like we haven't done your trach care yet today. So I'm just gonna do that procedure. Shouldn't cause any pain. I'm gonna go ahead and do an assessment on you first, just so I know that there's no changes that happen to you during the procedure. So I've got a pulse ox. You know, anytime we're messing with your trach, we like to watch your oxygen saturation. So I've got your O2 saturation there. I'm gonna take a listen to you. Take a deep breath. Deep breath. Good, your lungs sound clear. You must have been suctioned recently. Good, your breath sounds are clear, so I don't feel any need to assess your posterior side. Everything looks great. O2 saturation, 98%. That's wonderful. So I see we already have our trach care kit at the bedside. So what we're gonna do is we're gonna change your trach tie around your neck. I'm gonna do some cleaning. So I am gonna use some cotton swabs because I've got some really large fingers. I'm so sorry. We're gonna change out that inner cannula and then I'm gonna put some fresh gauze underneath, okay? Is it okay if I also ask for assistance from your husband at this time? Okay, thank you so much. Okay, so I'm just gonna start off by, I'm gonna move your oxygen out of the way just so slightly. I'm gonna put my finger on your faceplate and I'm just gonna pull out your old gauze. Should just tickle your throat a little bit. You might cough, that's okay. I'm gonna throw that away and I'm gonna grab your inner cannula with a little clasp, gonna pull that out, put your oxygen back over it, and I'm gonna discard of your inner cannula. And that is everything that's of the dirty part, and everything from here on out is gonna be the cleaning portion, okay? There's only one sterile part of this. I just don't want your hands to come into the field at all. And the only sterile portion is when I'm putting your new inner cannula back in, and then after that, it's just wound care. Okay, I know you're just like, what is wound care? So I've got some saline, because I don't think our kit has saline. It does not. I'm gonna go ahead and open up our new inner cannula. So getting my supplies open. So there's your new inner cannula. I'm gonna open up my trach care kit. I've got my gloves right on top. And since there's only one sterile part of this, I'm gonna go ahead and get to that first, which is changing out your inner cannula. So I'm gonna grab my first glove at the wrist. Shake that other one off. These gloves are very folded. There's that thumb. Oh, sterile gloves, Mrs. Payne, they just make everybody nervous. Our palms start sweating. All right, I can touch this glove now because this whole hand is sterile, so I can make this a little less nerve-wracking. All right. You know, as nurses, we have to talk to ourselves when we're doing sterile procedures because we get so nervous. We have to remind ourselves, I will not let sterile gloves defeat me. All right, sterile gloves are on. I'm gonna grab your inner cannula. I'm gonna move your oxygen source out of the way. I'm gonna stabilize your faceplate, come in at a little bit of an angle, and I'm going to lock that in place. I heard the click, move your oxygen source, and everything from here is clean. So we're on easy street now, so this is all great. Now we're just gonna get you all cleaned up, put some saline into my container. So since you had the disposable, I don't need to clean your inner cannula with that. Got a couple, well, those are gonna float, that's okay. There's my new split gauze. I'm gonna set that over here. I'm gonna divide my gauze. Some are gonna be wet, some are gonna be dry. And then I'm gonna get some new cotton because I like to scrub a lot. You're doing okay? O2 saturation is fine. Don't see any changes, so that inner cannula went in without any problems. I'm gonna move my stethoscope over here and let's get to cleaning Mrs. Payne. So the way I'm gonna do this is kind of like dividing this into 4 quadrants. I'm gonna clean underneath your faceplate. I'm gonna go away from your stoma. We're gonna go top part, bottom part, and then we'll switch to the other side. I'll dry everything, and then I'm gonna clean your faceplate. I'm gonna move your oxygen source just to the side so I can get to everything. I'm watching your O2 saturation. I'm stabilizing your faceplate and getting from your stoma and cleaning upwards, and only one swipe with each cotton swab. We're gonna come from the bottom part now and from the stoma outwards. Okay, I'm gonna do the top part over here, still stabilizing the faceplate. Get that all the way under there. All right, and cleaning up. I was not blessed with tiny fingers, Mrs. Payne, and so therefore I always have to use the cotton swabs. But people with little fingers can get their hands under there. Okay, now I'm just gonna dry the same way that we cleaned, so get a new one each time. Okay, get a new one. And I'm always stabilizing your faceplate so your trach doesn't move from the bottom part. Okay, great. So now I'm just gonna clean the top part of your trach, the actual front part of your faceplate, and just make sure that that's nice and clean. So make sure all of that's good. Get a new one. You don't see any desaturation. You're looking great. Can you give me a thumbs up that you're not in any pain? Great, thank you. Gonna just dry that. Okay, so now everything is clean and dry. I'm gonna put your new split gauze underneath it. So I'm gonna put my fingers underneath your trach tie. Your O2 saturation's still fine, so I haven't put your oxygen source back on. I'm gonna pinch with my fingers and pull that upwards. And I'm gonna come over to this other side. I'm gonna pinch that gauze with my fingers and pull that upwards. It's nice and smooth. I'm gonna put your oxygen source back on now. All right, so I'm gonna ask your darling husband to come. He's gonna put some gloves on. And sir, if you will just hold right here on this faceplate for me while I manipulate the trach tie. Yes, doesn't it feel great to help your wife? Okay, wonderful. So with the trach tie, I'm just gonna take that off. I have a new one ready. And this is just Velcro to adjust to everybody's neck if I need the extender. I have it. Okay. And so I'm gonna slip this out, and sir, just keep holding there every time I'm manipulating this. I'm gonna slide the old trach tie out. Put the new trach tie underneath you. Sorry to reach across you, Mrs. Payne. Okay, checking your skin. Don't see any breakdown, no moisture. I'm just gonna feed your Velcro. It's just like threading a needle. Mr. Payne, you're doing a great job of holding that trach tie for me. Okay, I'm gonna tighten that side. Okay, we're gonna come over to this other side here. Make sure that there's not anything in the way. And this is where two hands kind of just get in each other's way, but we just work around each other. I'm gonna feed this other side. Sorry, I'm reaching across your face, Mrs. Payne. Your husband's doing a great job of stabilizing that faceplate for me. Feed that through. Velcro and gauze are not good friends with each other. Okay, so I'm going to tighten that to right there, and then the rest of this gets tightened back with this one. So with your trach collar, I really only want to be able to get, I have big fingers, I just want one finger to fit underneath. Can you turn your head to the side? Great. Okay, that's not too tight. It's nice and equal. Mr. Payne, thank you. You can let go of that. Your oxygen source is there. O2 saturation is good. I'm just gonna reassess your lungs, make sure nothing changed. So we did move your trach around, make sure I don't have any funny noises. Deep breath in. Okay. Sounds great. Okay, I'll clean up my mess, Mrs. Payne. And we're done with your trach care. Take your O2 saturation off. Clean up my mess here. I'll let you and your husband get back to watching your TV shows. All that goes into the trash. I'm gonna clean my hands. Here's your call bell. Have a pillow somewhere. I'd put your pillow back. Because you have a trach, your head of the bed needs to stay up at least 30 degrees. Here's your call bell. If you need anything, you just let me know, okay? Thank you so much. It looks great, and if it gets dirty or soiled again with secretions, we'll just change that out then, okay? Thank you.